Okay, so the next thing after finishing schizophrenia and its treatment antipsychotic is the differential diagnosis of schizophrenia. And differential diagnosis of schizophrenia number 1 is none other than delusional disorders. Delusional disorder is itself a separate diagnostic entity, but as the name suggests, it has to have delusion. But it is not like schizophrenia. Means it has only delusion. Unlike in schizophrenia, schizophrenia is a condition characterized by split mind. So split mind means all the functions affected, delusion plus hallucination plus disorganized speech, disorganized behavior. While in delusional disorder, there is only delusion, other things are more or less normal. This is the first point to differentiate delusional disorder versus schizophrenia. Schizophrenia is a condition characterized by split mind, delusion, hallucination, disorganized speech, disorganized behavior. While delusional disorder is characterized by only and only delusions. Only delusions. Okay? All other things are normal. Okay? But another important point is schizophrenia has predominant socio-occupational impairment, which is less in delusional disorder. Schizophrenia has predominant socio-occupational impairment, which is less in delusional disorder. What do you mean by socio-occupational impairment? Socio means society function. Occupation means job. Your society function and job are more so affected in schizophrenia, less so in delusional disorder. Example. There's a person who has a belief that office colleagues are against him, they want to harm him. Despite this belief, he continues going to the job. There's no loss of the job, there's no loss of work. That is delusional disorder. But because of this belief, he resigns from his job and stays at his home. Schizophrenia. A person has a belief that neighbors want to kill him. Because of this, he stays at his house. Schizophrenia. Social impairment. Because despite this belief, he goes to their house every day to have tea. Delusional disorder. Got it? In NEET 2019, we got a question. Risk factors for delusional disorder. Delusional disorder are more seen in people of advanced age. Elderly are more at risk of delusional disorder. Sensory deprivation means poor in eyesight, poor in hearing, sensory deprived are more at risk of delusional disorder. A recent immigration. If you have immigrated from one country to another, that makes you at risk of delusional disorder. And fourth was social isolation. Socially isolated people are more at risk of delusional disorder as compared to people who stay in groups. Elderly are more at risk. Sensory deprived people are more at risk. Recent immigration. Recent immigration means one country to another, and socially isolated people are more at risk. Got it? Now, types of delusional disorder. Number one is paranoid disorder. As the name suggests, paranoid disorder is going to have delusion of persecution. People want to harm me. In this disorder, we have a phenomenon called pseudo community. What do you mean by pseudo community? It is defined as secondary elaboration of a delusion, also known as well systematization. Example, including more people. For example, a person has a belief office colleagues are against me. They want to harm me. Now a new person joins the office and talks to those two colleagues about any random neutral topic. And now my patient believes how many are against me? Two or three? Three. Now these three are chit-chatting with three other people of a different office. And now my patient believes how many are against me? Six. So in his mind, he thinks an entire gang wants to harm me. This phenomenon is called pseudo community, including more people in the delusional system. Another phenomenon seen is called folie à deux, shared delusional disorder. In this, delusion goes from one family member to another family member, usually from dominant family member to a dependent family member. Imagine a family of three people: father, elder son, younger son. An elder son had a delusion: neighbors are bad, they will harm, neighbors are bad, they will harm, neighbors are bad, they will harm. He keeps on saying every day, neighbors are bad, they will harm. Father explained, younger brother explained, but he is not convincible. After 1 year, whom do you expect also to say, neighbors are bad, they will harm? Father or younger brother? Younger brother. He has to say. Has to go from dominant to dependent family member. Second delusion is delusion of morbid jealousy. also known as Othello syndrome. Also known as delusion of infidelity. In this, the person feels that my partner is not loyal. If you see in textbook, you will find the definition: spouse is cheating, wife is cheating, husband is cheating. But let me tell you, technically wife, spouse, partner is not required. Even girlfriend, boyfriend doubt on each other. Live in relationship, so partner is not loyal. Okay? It includes everyone. In All India PG, a question came: this syndrome is more seen in alcoholics. Third, delusion of love, erotomania. De Clermont syndrome. In this, a lower socio-economic status female believes that a higher socio-economic status male is secretly in love with her. The word secretly is important. He loves me. He loves me a lot. I know he loves me. He doesn't say he loves me. Maybe he doesn't know he loves me. But I know he loves me. He loves me so much, so much, so much. So much, so much, so much. I know he loves me. He doesn't say he loves me. He loves me so much, so much, so much. I know he loves me. He loves me so much. From his eyes, I can know he loves me. He loves me so much. That's the reason he hasn't got himself married till now. Got it? That is delusion of love. Fourth delusion is somatic delusions related to body. My body has some defect or misshape. My body has insects or infestations. My body has a foul smell. There are three types of somatic delusions. Somatic delusions are also called monosymptomatic, hypochondriacal psychosis. because they are having single symptom. This is called delusional dysmorphophobia. My body has a defect, some misshape. This is called delusional parasitosis or Ekbom syndrome, and this is called olfactory reference syndrome. So there are three types of somatic delusions. Somatic means body related delusions. Soma means body. All these three are together known as monosymptomatic hypochondriacal psychosis. Hypochondriasis is a different disease. I'll teach you that in the next chapter. Chapter number 4, sorry. My body has some defect or misshape known as delusional dysmorphophobia. My body has some insect or infestation or parasite, delusional parasitosis. Ekbom syndrome. My body has foul smell, olfactory reference syndrome. In Ekbom syndrome, he keeps moving leg at night to remove the parasites. That's why Ekbom causes restless leg syndrome. Please remember, Ekbom is different, a cause of restless leg syndrome. Restless leg syndrome is a diagnostic entity itself. In Ekbom syndrome, we get a sign called matchbox sign. He thinks he has worms. We know he has no worms, so we tell him, show me the worms. He says, sir, there are not worms now, they come in the night. I said, okay, when it comes next time, bring it to me. And he takes me very seriously and literally. Next night, when he feels the urge to scratch his skin, he scratches his skin, and whatever comes in his hand, he puts it in a matchbox and brings the matchbox to me. I said, what did you bring? Sir, worms. When I checked it, it's empty. This sign is called matchbox sign. This question came in PGI Chandigarh exam. Matchbox sign is seen in Ekbom syndrome. Done? That's all about somatic delusions. Coming to the fifth and the last delusional disorders. Delusional misidentification syndromes. These are twin syndromes, so we will write them together. Capgras syndrome and Fregoli syndrome. Capgras syndrome and Fregoli syndrome. Capgras syndrome is also known as delusion of doubles. In this, the person believes that a persecutor who is a stranger has replaced my family member to harm me. Example, nurse coming in the disguise of wife. In Fregoli syndrome, my family member who is the persecutor has taken the disguise of stranger to harm me. Example, wife coming in the disguise of nurse. This is delusional misidentification syndrome. The catch is, who is the persecutor? If persecutor is a stranger, some outside person wants to harm you, then it is Capgras. And if your family member wants to give you goli, then it is Fregoli. So, if persecutor is a stranger, outside person wants to harm you, coming in the disguise of family member, it is Capgras syndrome. In Capgras syndrome, the person will start shouting, looking at his actual wife, saying that she is the nurse in the disguise of the wife, but she is wife, but he thinks she is nurse in the disguise of the wife. He starts shouting, looking at the wife, saying she is the nurse, but she is wife. He thinks she is nurse in the disguise of the wife. In Fregoli syndrome, the person will start shouting, looking at the nurse, saying that she is the wife in the disguise of the nurse, but she is actually the nurse. He misidentifies the nurse as his wife in the disguise of the nurse, saying that she is the wife, coming as the nurse. So who wants to harm wife? Coming as the nurse. He is looking at nurse, saying that she wants to harm, but she is nurse, but he thinks she is wife in the disguise of the nurse. The same question came in AIMS November 2017 and it was very confusing. So that's why I'm saying you just remember like this. If outside person wants to harm, it is Capgras. And if family member wants to give you goli, it is Fregoli. That is all about delusional disorder. That is all about psychotic disorder. Make sure before you finish chapter number 2, do the 10 MCQs in the next video discussion of chapter number 2. In every chapter, I've tried to add 10 MCQs for your reference. You can do more number of MCQ from DQB or Psychiatric Question Bank authored by myself, available on Amazon, Flipkart, everywhere. but 10 at least you must do from the videos attached. Thank you.